Hello everyone and welcome back to my channel. I'm Dr. Nkendong, psychiatric mental health nurse practitioner, and today we're diving deep into some unique and evidence-based techniques to help you conquer anxiety at night and overcome insomnia. Remember, this information is for educational purposes only, so consult your healthcare provider for personalized advice. Imagine this scenario: you're lying in bed and your mind is racing with thoughts about needing to fall asleep. If this is you, the following interventions may help. Instead of struggling against these thoughts, we're going to embrace them. Yes, you heard me right. To apply paradoxical intention technique, when you find yourself in this situation, acknowledge those thoughts and tell yourself that you actually want to stay awake. Embrace the idea of staying awake, even if it seems counterintuitive. The challenge here is letting go of the pressure to fall asleep, which can be quite daunting. It's common to feel frustrated initially, but here's the solution: relax. Take a deep breath and let your mind drift. By willingly accepting wakefulness, you reduce performance anxiety associated with falling asleep. You're no longer in a struggle, and often you'll find that as the pressure eases, sleep comes more naturally. It's crucial to differentiate between a decreased need for sleep seen in manic episodes and insomnia. In cases of mania, individuals often experience a decreased need for sleep, feeling energized and fully awake even after just a few hours of rest. This is a hallmark symptom of bipolar disorder. In contrast, insomnia typically involves struggling to fall asleep, frequent wake-ups during the night, and feeling fatigued during the day. Understanding the differences between these two conditions is vital for accurate diagnosis and appropriate treatment. Additionally, it is essential to emphasize the importance of consulting your healthcare provider. While these techniques can be highly effective, it's essential to rule out any underlying medical conditions or psychiatric issues that may be contributing to your sleep difficulties. This step cannot be stressed enough. Insomnia can be a symptom of various underlying conditions such as anxiety disorders, depression, or medical problems like sleep apnea. By speaking with your healthcare provider, you can ensure that you're addressing the root cause of your sleep issues rather than just the symptoms. So, as we explore the paradoxical intention technique, remember to maintain an open and honest dialogue with your healthcare provider. They can help you determine if this technique is suitable for your specific situation and provide guidance on addressing any underlying issues. Now, let's explore other techniques to calm your nighttime anxiety and overcome insomnia. The military method, which is rooted in evidence-based practices for promoting relaxation and better sleep. This technique involves a precise sequence of relaxation techniques that have been shown to be effective in reducing anxiety and helping individuals fall asleep faster. To begin, find a comfortable and quiet place to lie down. Close your eyes and take a deep breath to initiate the process. The first step is to relax your face muscles. Release any tension you may be holding in your forehead, cheeks, and jaw. Allow your facial muscles to become completely relaxed. The second step is to relax your shoulders. Imagine any tension melting away as you consciously lower your shoulders and let them rest naturally. Feel the weight of relaxation in your shoulder muscles. Moving on to the third step, focus on relaxing your arms and hands. Release any tightness in your arms from the upper arms down to your fingertips. Let your arms become heavy and relaxed as if they're sinking into the mattress. Next, bring your attention to your chest and torso. Take a deep breath and exhale slowly. Feel the tension leaving your chest as you continue to breathe calmly and deeply. The fifth step is to relax your legs. Starting from your thighs and moving down to your calves and feet, consciously release any tightness. Let your legs feel limp and heavy as if all the stress is draining away. Maintaining focus and order during the military method can indeed be a challenge, especially when you're first starting. It might feel unusual or even counterintuitive to intentionally relax each muscle group. However, with consistent practice, you'll become more proficient at moving through these steps in a fluid and relaxed manner. To make this process even more accessible, you can consider recording a guided audio of yourself talking through the steps. This way, you can simply play the recording and follow along, allowing your mind to let go of any racing thoughts as you progress through the muscle relaxation sequence. Remember that the military method is just one tool in your arsenal to combat insomnia, and is particularly effective for individuals who struggle with racing thoughts and anxiety at bedtime. As with any technique, consistency is key to experiencing its full benefits. Another powerful technique is guided imagery with sensory distraction. This evidence-based approach can be incredibly effective in calming the mind and promoting restful sleep. It involves creating a mental sanctuary where you can escape the anxieties of the day and immerse yourself in a peaceful and tranquil environment. To begin, find a comfortable position in your bed. Close your eyes gently and take a few deep breaths to help you relax and center yourself. As you do this, start to visualize your ideal serene place. For example, imagine yourself on a beautiful, sun-kissed beach with powdery white sand. Let's engage your senses. Picture the gentle waves lapping against the shore. Visualize the clear, blue sky above and feel the warmth of the sun on your skin. As you breathe, imagine the salty sea breeze filling your lungs and hear the soothing sounds of seagulls in the distance. The challenge with guided imagery is creating vivid mental imagery, especially if you're new to this technique. Some individuals may initially struggle to visualize these sensory details with clarity. If that's the case, don't worry, it's completely normal. The good news is that you can use recorded guided imagery sessions to help you get started. Over time, as you practice guided imagery more frequently, you'll find it easier to create these vivid mental images on your own. Remember, the power of guided imagery lies in its ability to transport your mind to a place of tranquility, away from the worries and stressors of daily life. This technique can significantly reduce anxiety and racing thoughts, making it easier to fall asleep naturally. This concludes our intriguing and lesser-known techniques to tackle nighttime anxiety and insomnia. Remember, applying these techniques may require patience, but the key is consistency. If you find this video helpful, please give it a thumbs up and share it with someone who might need it. And don't forget to subscribe to my channel for more fascinating insights into mental health and well-being. Thanks for watching, and here's to peaceful, anxiety-free nights.